think I will go ahead and get us started. I want to welcome you all to today's talk. It's part of the University of Nebraska-Lincoln's Minority Health Disparity Initiatives Equity Speaker Series. So welcome everyone. It is my pleasure to introduce today's speaker, Dr. Katie Edwards. Dr. Edwards is an associate professor in educational psychology at the Nebraska Center for Research on Children, Youth, Families, and Schools at the University of Nebraska-Lincoln. Dr. Edwards' work focuses on the development, implementation, and evaluation of violence prevention and response initiatives, predominantly among adolescents and young adults from marginalized groups in the US, including those identifying as American Indian and LGBTQ+, which is the focus of the talk today. She uses community-engaged approaches to integrate community voices in the research process to produce more meaningful and impactful programming. To date, she has published over 150 peer-reviewed publications on these topics and has current funding from the Centers for Disease Control and Prevention, the National Institute of Health, the National Science Foundation, and the Department of Justice. Please welcome Dr. Edwards.
Thank you, Lori, for that introduction, and for you, all of you attending today. I'm really excited to speak with you all today about some of the work that I've been doing with colleagues, including Lori, and members of my research lab. And today I'm going to be talking specifically about preventing dating and sexual violence among LGBTQ+ youth. And I'll be highlighting several studies in which we use community-engaged approaches to do this work. There we go. So in the research lab that I run, the Interpersonal Violence Research Laboratory, there's two guiding questions that we really seek to answer across all of our projects. The first one is, how do we prevent dating and sexual violence? And the second one is, how do we support survivors in the aftermath of victimization experiences? And so what I'm going to really be focusing on today is that first research question, and specifically the work that we do in my lab around LGBTQ+ youth. So what I'm going to do today is start with some foundational information. So a little bit more around dating and sexual violence among LGBTQ+ youth and emerging adults, kind of what we know, what we don't know, highlight some of the ways in which we go about doing this work in a way that's respectful and really empowering the voices of community members and the populations we serve to really lead the work that we're doing. And then I'll provide two examples. One that is, we're wrapping up, that's a community-based sexual violence prevention initiative, and then a newly funded grant that's an online program to prevent dating and sexual violence and alcohol use among LGBTQ+ youth. So again, I'm sure all of you are familiar with definitions of sexual assault and partner violence, but I want to just kind of lay the foundation for how we think about these things in our work. So we really think about sexual assault as existing on a continuum, and these can be things such as unwanted touching, unwanted contact, ranging all the way to attempted or completed rape. So we really look at unwanted sexual experiences really along this continuum and a spectrum of behavior. Partner abuse can certainly include sexual assault, but we also know that it can include other forms of abuse, such as physical abuse, emotional abuse, and stalking as well. And we know, particularly within the context of adolescent and adult relationships, these can also happen in hookup relationships, friends with benefits, and so forth. And so we try to be really inclusive when we're thinking about relationships, what that means, as well as the different types of abuse. So this is data from the Center for Disease Control and Prevention, their YRBS data. This was just published a couple months ago, and this was findings from the 2019 YRBS. So this is a national survey of high school students across the United States. And what you can see here is consistent with a growing body of literature demonstrating that sexual minority youth, LGBTQ+ youth, experience disproportionately high rates of both physical dating violence as well as sexual assault. So you can see here, for example, for physical dating violence, that we see that gay or lesbian youth, bisexual youth, as well as youth who are unsure of their sexual orientation, are at higher rates to experience physical dating violence victimization. And these are rates just in the past 12 months. And similarly, we see for sexual assault, particularly bisexual youth being at the highest risk, followed by gay and lesbian youth, as well as youth who are unsure of their sexual orientation. And so again, for example, this is nearly 1 in 4 bisexual youth reporting being sexually assaulted just in the past year. This is a paper that we just had recently accepted for publication. This is by a colleague of mine, Jillian Shear at Syracuse, who I work with. And we used a really large database that had over 15,000 sexual and gender minority youth. And we wanted to really look at variability within this population of different types of abuse that they experience. And so what we found is that there are essentially 3 classes or 3 different types of profiles of abuse experienced by sexual and gender minority youth. So you can see class 1, this was a no or low victimization class. Class 2 was a sexual harassment and SGM-based bullying class, so youth who are bullied based on their sexual orientation and or gender minority status. And then class 3 was a poly-victimization class. And so what you can also see here is that over 60% or nearly 60% of the sample were in either class 2 or class 3. So the majority of the sample was not in the no victimization class. Again, underscoring the high rates of multiple forms of violence experienced by sexual and gender minority youth. We also found in the study that trans and gender diverse youth, as well as youth who are experiencing rejection from their family based on their sexual orientation and or gender identity, were more likely to be in the poly-victimization class than the non-victimization class or the other victimization group. Not surprisingly, depressive symptoms, self-perceived stress, and alcohol and marijuana use, as well as cigarette use, they varied as a function of class, with these being higher and more severe classes of victimization. So in addition to work with middle and high school students, I do a lot of work also with college students. This was a study we published several years ago. It was a large sample of college students across Upper New England. And what we found here is consistent with what we found in our work with high school, that we see that sexual minority students reporting significantly higher rates of various forms of violence than heterosexual students. So for example, just in the past 6 months, nearly 1 in 4 sexual minority students reported having some unwanted sexual experience compared to a little over 1 in 10 heterosexual students. So not surprisingly, we know that there are a number of negative outcomes associated with dating and sexual violence. Psychological distress, physical health problems. In more recent work, we've documented academic failure, as well as school dropout, social and interpersonal problems. And we also know that youth who experience dating and sexual violence are more at risk for re-victimization later in life. And more interestingly, perhaps, we found in some of our recent work that outcomes for dating and sexual violence seem to be worse for LGBTQ plus youth compared to heterosexual cisgender youth. And we'll be talking a little bit about why that might be the case here in a few minutes. So one of the things, I'm not going to be focusing so much on recovery today, but I think this is really important because we know that the vast majority of young victims disclose their victimization experience to another individual. And this is true for LGBTQ plus youth and young adults as well. And what we know is that the way in which people respond have have a very strong influence on how people cope with those experiences, and ultimately if they develop depression, PTSD, problem drinking, and so forth. And what we also know is that even though the majority of sexual and gender minority youth will disclose to someone, it's most commonly to a friend and less to formal support such as police, medical providers, counselors, and so forth. This was in a study that we did with young adults across the United States. These are all LGBTQI plus identified survivors of intimate partner violence. And these are kind of some of the themes that emerged from our qualitative data around what were things that were helpful and not helpful. So one of the most unhelpful things was not understanding the situation. So for example, one participant said, when someone called the police, for example, when he was drunk and came home kicking me and beating my face, I opened the door and the police put me in handcuffs and dragged me off. Just because I'm bigger than my partner doesn't mean I'm the aggressor, but that's what they thought. I was bloodied and bruised and they took me because they thought I was the man in our relationship. Other individuals said that giving advice or taking control of the situation was unhelpful. So for example, one person said, I had sought past advice from my straight friends. I found them to be less helpful. Their personal experiences with men who are controlling them seemed to be more threatening than my experiences with women, and their advice tends to be majorly off the mark. Another survivor said the medical personnel pushed for legal action, and sometimes it's not required. So in terms of what LGBTQ plus survivors found is most helpful, these were things like empathic support, talking or listening, practical support, as well as giving advice in a way that doesn't seem like you're taking control of the situation. And so again, what we found in this study was not only insights into what was helpful and unhelpful, but we also found that individuals reporting more of these unhelpful responses had greater rates of psychological distress. And interestingly, individuals who were higher in more proximal forms of minority stress were less likely to disclose to anyone. So feeling ashamed of their sexual orientation, not being out, those individuals were less likely to disclose at all, which helps us to understand one of the reasons why we might see worse outcomes of dating and sexual violence for sexual and gender minority youth compared to heterosexual cisgender youth. So I'm sure you all are familiar with the minority stress model. This is really what guides all of our work in this area. So we look a lot at how distal minority stressors such as discrimination, hate-based violence, how that leads to internalized or proximal forms of minority stress. So expectations of rejection, identity concealment, and internalized homophobia, biphobia, and transphobia. And what we know from a large body of literature over the past few decades is that these experiences of minority stress lead to a number of deleterious mental health outcomes. And more specific in our work, we look at how these lead to increased risk for dating and sexual violence perpetration, victimization, as well as adverse outcomes associated with victimization experiences. So in a current NSF grant that I'm working on, along with other collaborators, including Lori, who's here today and working on pretty much all of these projects with us. So this is kind of taking this initial model provided by Myers and building off of that from other literature to really look more at how sexual stigma exists at multiple levels within the social ecology. And we're doing a specific study to test this model with college students. And so what we're really looking at is how broader indicators of campus climate, as well as how heterosexual students and as well as heterosexual faculty, staff, administrators, how their attitudes and behaviors, all of those things really work together synergistically to impact how LGBTQ plus students feel about themselves in terms of their own internalized homonegativity, as well as outness. And then looking at how those things longitudinally predict things like hazardous drinking, psychological distress, which subsequently may increase risk for intimate partner violence. And again, more deleterious outcomes associated with those experiences. So again, really trying to move beyond just looking specifically within individuals and looking much more broadly at how different factors within a campus community may impact LGBTQ plus students' experiences. So we know that dating and sexual violence occur at really high rates, disproportionately higher rates among sexual and gender minority youth compared to heterosexual cisgender youth. You see devastating short and long-term outcomes, which really underscores how critical prevention is. Unfortunately, to date, existing programs don't seem to be working as well for sexual and gender minority youth. So there's been 2 papers published recently, one out of my lab, another with Ann Coker at University of Kentucky. And these are all with bystander-focused prevention programs. So they were created for high school students universally, and essentially bystander programs teach other individuals how to recognize warning signs of violence, and most importantly, how to safely and effectively intervene in those situations to stop and prevent violence from happening and support survivors. And so 2 commonly used programs that have been evaluated are Green Dot and Bringing in the Bystander. And what Coker and colleagues found in their study was that sexual violence, sexual harassment, and physical dating violence, it decreased for heterosexual students, but there was no program impact for students who identified as sexual minorities. And we found something very similar in our studies, that sexual harassment and stalking decreased for heterosexual students, but it did not change for sexual minority students. So again, seeing that there's essentially no impact. And so what I will be talking about is, in our work, trying to do more and trying to do better for LGBTQ plus youth. And so really moving away from these really heteronormative forms of programming, thinking about what types of aspects of programming do we need to be effective for LGBTQ plus youth to prevent dating and sexual violence, not only in our work with youth, but of course, thinking more on a macro level around systemic inequalities and injustices that we know perpetuate these forms of violence. So I'm going to start now a transition into two examples. One is a community-based youth-led sexual violence prevention program that we're wrapping up. And another one, we don't have any data yet, but it's an online program to prevent dating and sexual violence and alcohol use among sexual and gender minority youth. And both of these, I'll be highlighting the ways in which we're doing this in a community engaged way. So again, the work that we do in the lab is all community engaged, very much grounded in participatory action research methodologies and principles. Again, we find this work to be not only the most exciting work to do, but by far the most impactful when we really amplify the voices of the individuals that we seek to serve and allow them to be equal collaborators in making all the decisions with the research team. So essentially in our work, communities are engaged in all phases of the research. So we work with community members, with boards. What is the problem that you're seeing in your community? How do you think you should address it? What are the strengths of the people in your community? Collective resiliency, and how can we use that to leverage making change? Also, equitable relationships between researchers, practitioners, youth, survivors. This is something that's really important. So it shouldn't be that as the PI or the researcher, my perspective matters more than the youth sitting across the table from me. So really trying to make sure that all voices are equally valued. And again, that comes into play from that conceptualization piece to recruitment, to measurement selection, to program implementation, to dissemination. Also having a shared purpose. I've learned from a lot of the community partners that I work with that it's not only important to be collaborative, but to really be passionate about the same things and to create relationships. So without trusting strong relationships, this work is not going to be possible. Of course, a commitment to diversity and inclusivity. So making sure that you have diverse representation at the table when you're working on these projects together. And again, trust, that's such a critical piece of this, feeling like we have trusting relationships. This is hard work. There's going to be hard conversations. Sometimes what a community member wants versus what a funder wants can be different. And so really having trusting relationships is the foundation on which all this work is possible. And related to that is transparency. So just, again, at all stages, being really clear, what are expectations of funders, where is all the money going to? So making sure that community members understand this is the amount of the grant, here's where the funding's going to, being honest about how decisions need to be made and so forth. And a big part of this too is, thinking around data ownership. So of course, with all the tribal communities I work with, they own the data, but even in non-tribal communities, we work really closely to make sure that the community feels like they have ownership of the project, the data, how the data are shared. And so community members and boards work really closely with us, not only to share ideas about the findings, but to co-author them with us, to travel to conferences and so forth. So the first example I'm going to talk a little bit about is Youth Voices in Prevention, or Youth VIP. Youth VIP is funded through a Center for Disease Control and Prevention grant. We are in year 5, so we're wrapping up the project right now. We have a few months and then funding's officially done. And this is a really interesting project because the CDC wanted to fund a collaboration between researchers and practitioners to really develop and evaluate what they were calling grassroots prevention. So they didn't want to test an existing program. They wanted to really gather what are some novel ways that community members and researchers can work together to try to prevent sexual violence. And so I had the fortune of connecting with a community in South Dakota, Rapid City specifically, which was the first community I worked with in South Dakota. And now I work with multiple communities and my second home. So really what we wanted to do was to work together to create a youth-led sexual violence prevention program. And so this involved multiple stakeholders who I'll speak about here in a few minutes, but really the goal of this kind of grassroots initiative not only was to eliminate sexual violence and related forms of violence, but doing it through empowering youth. So really this was meant to be an initiative led by youth with adult partnerships to prevent sexual violence. And so how this worked is there were numerous activities that I'll talk about in a minute. And youth leaders were essentially trained by adults in best practices to prevent sexual violence. And then youth were encouraged to share the information and skills that they learned with other youth in their community. So the idea really was not only for there to be change within youth who participated in youth VIP activities, but to empower those youth to go through both formal and informal activities to share what they had learned, specifically skills with other youth to see, can we see community-wide change? And so this happened through activities. There were overnight camps, after school activities. And although initially the camps, for example, were led more by adults, over time, youth began to take more ownership and they were leading camps, helping to plan them. Youth led all the after school activities and so forth. And again, this was, although we did, we surveyed middle and high school youth throughout the district of Rapid City. All the programming events took place outside of school. So again, the part of doing community engaged work is making sure that you have multi-stakeholder collaborations and that you have a lot of support from different agencies and organizations within the community that represent a diverse or serve a diverse group of individuals. So again, this was a grant that was funded through the CDC, and we had a number of different partners. So South Dakota Rape Prevention Education Agencies, the state level network against family violence and sexual assault, and then a number of partnering organizations specific in Rapid City, all doing work around violence prevention and or working with youth specifically. So in terms of best practices in sexual violence prevention, youth were really trained in several different core areas. And then again, they were encouraged to take what they learned and share it with other youth. Sometimes this was through informal conversations. Other times this was through activities that they would lead in the community, like an after school event or through subsequent camps and so forth. So one of the things that youth learned were bystander intervention skills. So how to help in situations of sexual violence, sexual harassment, dating violence, bullying, and racism. Also social emotional skills. So how to manage one's emotions and interact with others in healthy and respectful ways. Also, youth were trained on how to spread the message that sexual violence is not acceptable in Rapid City and that everyone has a role to play in ending sexual violence. And then youth were also given specific skills on how to share what they've learned with others. So they basically created like little mini speeches that they would then practice with their peers that were part of Youth VIP, and then go practice having, and then go and have those actual conversations with other youth. They would create social media posts to really help reinforce a lot of the programming that they were doing, and the social media had a lot of followers throughout the community. And then finally, there's a large presence of Native Americans in Rapid City. And so all Youth VIP activities included the integration of Lakota culture, values, traditions, and languages. And you might be thinking, what does this have to do with LGBTQ youth? So I'm going to talk about that here in a second. But again, this was really a youth-led initiative in which youth and community partners were guiding this whole process from what the program looks like, how to deliver it, how to see if it's working. And we did a lot of intentional recruitment, not just of Native youth, but of LGBTQ plus youth. And we found some really interesting outcomes specific for LGBTQ plus youth, which I'll talk about here in a second. But before that, with permission from the youth and their guardians, we have permission. These are all on our social media sites. But these are just some examples of activities that youth are participating in. Overnight camps. Of course, the camps are meant to be fun. So you see some youth doing road courses. The candle activity was a diffusion activity. So again, the idea that if one person has their candle lit, they share what they've learned with one other person. that person shares that quickly the whole community in Rapid City, can kind of be part of this movement. And so it started with one use candle being lit, and then within, less than a minute or two, over 100 use candles were lit to kind of demonstrate that diffusion piece. So just some more activities. The top right, the youth actually were in the was the Native American Day Parade. This was the float they wanted to create. They actually won first place, which we were really excited for them for. The bottom right-hand corner, youth are using survey data to kind of spread the good news, right? So again, we know with social norms marketing, you always want to share the good news. So the good news is that most people in Rapid City want to help to prevent sexual violence. So that's the posters that some of the youth made to kind of share that good news using actual survey data from youth in the community. And then a big part of this was art murals. So youth did a lot of work in the community to paint murals, have conversations with youth about them. The one on the left was one in which Native youth who are part of Youth VIP came together to work with Rapid City Area Police Department to really draw attention to domestic violence and the role that everyone has to play in ending that, and also to really try to start repairing some of the understandable distrust between Native Americans and law enforcement in this community. So in terms of what we found, so basically youth who participated in Youth VIP compared to those who did not. And again, this was over 2.5 years of data collection. So we had 5 waves of data collection following middle and high school students over 2.5 years. And what we found is that those who were involved in Youth VIP compared to youth who were not had more acknowledgement of sexual violence as an issue. They engaged in more positive bystander behavior when given the opportunity to intervene in a situation of sexual violence. They were less likely to perpetrate some forms of violence. And this final finding at first surprised us in terms of a higher likelihood of reporting victimization. What we think might be happening here is that at pretty much every single Youth VIP event that we had, there were youth who were disclosing that their dating partner had hurt them, or that their peer had sexually assaulted them. And so we quickly learned that Youth VIP was becoming a space for a lot of not only prevention, but a lot of disclosure and seeking youth supports. And so one of the things we wonder is if people were more likely who were exposed to Youth VIP to subsequently on surveys report disclosing victimization, whereas they may have been more hesitant to do so previously. So here's how it relates to LGBTQ plus youth. The really fascinating thing that we found was that actually the program worked better for sexual minority youth, which is kind of the first time that we're familiar with seeing a finding like this. It's usually the opposite. So we actually found that the program worked better for sexual minority students compared to heterosexual students. Similarly, we found that the program on a number of indicators worked better for Native youth and non-Native youth. And I'm going to talk in a minute about why, but before I do that, we also found some indicators of diffusion. So friends of friends who participated in Youth VIP had more awareness of Youth VIP, so they knew what it was, they had talked to their friends about it, and also they were engaging in more positive bystander behavior themselves. So again, youth who never had been to a single Youth VIP activity, if they were connected to youth who had been, then we saw these positive outcomes. So why did Youth VIP work better for LGBTQ plus youth? So again, this wasn't something necessary. This was a broad, universal primary prevention program for youth in this one particular small city. But why do we think it actually worked better for LGBTQ plus youth? One of the things that we did is we were really intentional on recruiting diverse adult mentors. So we had a number of LGBTQ plus adults who are out about their sexual orientation and gender identity, who mentored youth, which I think drew in more LGBTQ plus youth from the community. We also had a number of Native youth or Native mentors as well. We were really intentional, of course, with youth input and youth leadership around sleeping and bathroom arrangement at overnight camps. So for example, trans and other gender diverse youth had the option of picking, if they wanted to stay in kind of the girls' cabin, the boys' cabin, or in a room that was specifically with gender and other diverse or trans and other gender diverse youth. Also, in addition to gender neutral bathrooms, some trans and gender diverse youth felt we really don't want to shower around anyone else. And so we were really intentional and thoughtful in how sleeping in bathroom arrangements worked as well. There were also confidential discussion groups. So again, when we would do the overnight camps, there'd be like activities and breakouts that youth would choose from. And one thing that we had consistently were these discussion groups that were just for LGBTQ plus youth, again, led by adult mentors who were LGBTQ plus as well. And so again, kind of the context of the city in which this took place in, for example, in schools, these are not topics that, you're allowed to discuss. These are, so for a lot of youth, this was like the first time for many of them that they were able to sit in a room with adults and to share and to ask questions, things around coming out, to trying to understand how this makes sense within the context of being part of a highly religious family. How do I tell my family? Do I not tell my family? So I think these were really impactful for youth. And then, of course, we had a presence at Pride. Youth who were part of Youth VIP would go and have a booth there with adult mentorship. And again, we didn't measure anything specific to, proximal forms of minority stress. But one hypothesis that we might have is these aspects of Youth VIP, the presence of them, may have helped to reduce proximal forms of minority stress for youth, which in turn could help explain perhaps why the program worked better for them than heterosexual youth. So the final thing I'm going to talk about today is a new grant that we've received from NIH to develop and evaluate an online intervention to prevent dating and sexual violence, as well as alcohol use among sexual and gender minority youth. So as we've already talked about, we know that LGBTQ plus youth report alarmingly high rates of dating and sexual violence. They're also more likely than heterosexual cisgender youth to engage not only in alcohol use in general, but binge drinking, heavy episodic drinking as well. We also know from research that alcohol use is a robust predictor of dating and sexual violence. So not only can dating and sexual violence lead to alcohol use as a coping mechanism, but we know that alcohol use has been shown in a number of studies to prospectively predict both victimization and perpetration of dating and sexual violence. And so what we want to do in this program is to include evidence-based strategies to reduce dating and sexual violence and alcohol use, such as bystander intervention, social norms, but we really want to have an intentional focus on reducing proximal minority stress for youth as well. So this is an example of our program model. So we have three major key components of our intervention that we're developing. One is minority stress, so really seeking to reduce particularly proximal forms of minority stress through exposure to healthy adult role models, connection to other LGBTQ plus youth, healthy coping, also specific components that we know work for dating violence prevention more broadly, conflict resolution skills, refusal skills, bystander intervention skills, and correcting misperceptions of social norms. And then again, alcohol use prevention skills. So refusal skills, personalized normative feedback, and protective behavioral strategies. And we hypothesize that this will lead to a number of intermediate outcomes, such as decreased identity concealment, decreased internalized homophobia, transphobia, and biphobia, increased sense of community to the LGBTQ plus community, healthy coping, conflict resolution, refusal skills, bystander behaviors, and so forth. And then our main kind of big outcomes, right, are reducing perpetration, reducing victimization, also reducing alcohol use, and then some other secondary outcomes we think we might move the needle on, although not the direct focus, things like depression, drug use, as well as risky sexual behavior. So again, this is very much a youth-led initiative. We had initial input from youth when we first submitted the grant. Right now, we just finished. Alex, who's a fabulous graduate student I have the privilege of working with, we just finished doing recruitment for our youth advisory board. We were only supposed to have around 10 to 12, but we couldn't say no to youth because they were amazing. So we have 19 LGBTQ plus youth right now on our board from across the US. We recruited them on social media. So we use social media ads, which we use a lot in our research studies, particularly trying to reach LGBTQ plus youth. And I'm happy to talk more about with any of you all who are interested in how you can use social media algorithms, geospatial stuff that I don't entirely understand, but people on my team do. But anyways, we just completed meet and greet. So we didn't want to hold formal interviews. We didn't want that to feel intimidating. So we essentially had kind of open hours on a weekend and then a few weekend evenings where youth could kind of pop in and out, learn more about the project, ask us questions and so forth. We have our first big official meeting as a group this coming Saturday. We'll meet for about an hour and a half, and then we'll be meeting regularly every 1 or 2 months for the next 3 years, although youth are only asked to commit to up to 1 year, given that life happens and schedules get busy. Similar to when we actually do the research evaluation, we were able to work, so the research piece, we worked with the IRB to waive guardian consent, and we actually were fortunate to work with HR here at UNL to not have to get permission for youth to participate in order to be receiving compensation for the board. Since the board itself isn't a research project, we had to work with HR to get that approval. Not surprisingly, our reason for doing that is we know that some youth aren't out, and one, if you've had to get parental or guardian permission, they likely wouldn't be part of the board of the research project. And it could also be really harmful for some youth to actually, if they aren't out and they wanted to be part of this, to try to ask a caregiver or parent. So the youth are going to be doing everything in terms of naming the program. So I'm going to be sharing here with you all in a few minutes kind of an outline of the program, but really that's all we have, and the rest is going to be driven by the youth in terms of content, activities, branding, and so forth. And then in addition to the program, they're going to be working with us on how do we recruit effectively, what are effective retention strategies they think we should use, giving feedback on surveys and so forth. So again, really youth are working with us side by side to help make this project a success. And I will just say, I mean, I've had youth advisory boards before, and just these youth were just, I swear they're going to change the world. I mean, these are just such a group of passionate youth all over the US, different social identities, some from rural areas, some from urban areas, some that are super out, doing a lot of activism, a number of youth who aren't out at all. And in addition to just getting their, having them partner on this project, we also want this to be a fun and rewarding experience for them. And hopefully this will also make an additional space for them to have a sense of community as well. So in terms of the program, what we've proposed is 8 45-minute modules. It'll be live facilitated on a HIPAA compliant version of WebEx. The target audience will be LGBTQ plus youth 15 to 18 across the US. And it'll be led by 2 LGBTQ plus identified adult facilitators. We're going to be oversampling using social media algorithms, LGBT youth of color, as well as LGBTQ plus youth residing in remote and rural areas of the US. Our reason for the rural areas, as we know, often minority stresses are highest in those areas, and resources are often either limited or non-existent. And again, for the research evaluation piece, we'll be receiving a waiver of guardian consent. And we actually already, have obtained that through the UNL IRB. So I'm going to just kind of run through a little bit about what the program looks like so you have some more specific details. Also open to feedback. I'm sure that the youth would be eager to hear what other people think as well. So every session will start off with welcomes and introductions and ground rules. This first session is really around relationship building and also starting to really kind of work towards those minority stress pieces. So the facilitators will define sexual orientation and gender identity, disclose their own sexual orientation and gender identity, and then engage youth where sexuality tree and or the gender bread activity. We're still working with youth on that. Facilitators will debunk myths about LGBTQ plus individuals and provide youth with positive affirmations. The youth will, or the facilitators will show youth a video that have diverse youth and adults sharing about recognizing their sexual orientation, when and how they came out, and then engaging youth in discussions about barriers to coming out And again, every session will have lots and lots of resources for you. So the second module is really about building sense of community, and also understanding, more around chosen family, that family can often be, different than non-traditional definitions of family, especially for youth who may be experiencing family and caregiver rejection. So youth talk about the ways in which they can be involved in safe and inclusive communities. Facilitators provide suggestions on this. And also, really thinking about, particularly for youth who can't be out in their communities, how can they connect with youth in other ways and in ways that are safe? And so again, a lot around internet safety tips. So module 3 is coping with stress. So facilitators will engage youth in discussions about things that stress them out, how they manage that. Facilitators will provide feedback on what's healthy and unhealthy coping, model healthy coping for them, and then have youth kind of practice putting those coping skills into action. So module 4 is when we move more specifically particularly into the dating, violence, and alcohol use prevention pieces. So really first is understanding what is dating and sexual violence, so that continuum of abuse piece, understanding what are the consequences associated with these types of behaviors, and also specifically for alcohol use, protective behavioral strategies. So these would include things like, right, if you're going to, a party and there's going to be alcohol, make sure that you have water in between drinks, or make sure that you never leave a friend alone at a party. So knowing things that from other research that we know that works more broadly around protective behavioral strategies, seeing if these will work similarly for LGBTQ plus youth as well. Again, the goal is to prevent alcohol use at all, but we know that for some youth that are already using, that's not possible. And so what we're trying to really do in this is, if we can't prevent alcohol use at all, to try to at least prevent harmful outcomes associated with alcohol use. So module 5 focuses on creating positive relationships. So helping youth to understand what are characteristics of healthy and unhealthy relationships. There'll be videos again with couples discussing relationship issues and the role of healthy communication. Facilitators will model healthy and unhealthy communication, and then youth will practice through scenarios, those ways of managing conflict with healthy communication strategies. And then also related to that will be definitions of sexual consent, how to seek consent, how to also refuse sex that you are not consenting to, and then also alcohol refusal skills. So if someone's pressuring you to drink alcohol, what are the things that you can say and do? Module 6, this kind of shifts into more of the bystander piece. So talking to youth about what is a bystander, what are the things they can do to help keep them safe and other youth safe, not only from dating and sexual violence, but also in high-risk drinking situations. And then again, having them role play through scenarios, different ways they can intervene in these risky situations. And then again, how to get help for themselves and others if they're experiencing dating and sexual violence, or concerned about their own drinking or a friend's drinking. And again, those resources are very much embedded into all of the sessions. So module 7, this is really around correcting misperceptions of social norms. So we know from research that youth and young adults always overestimate the bad and underestimate the good and what their friends and peers are doing. So, for example, if you ask a group of college students, what percentage of other college students at your school are getting drunk, 4 out of 7 nights a week, they'll say 30 or 40%, when in reality it's 10%, right? So we know that people are often overestimating the bad, underestimating the good. And when there's that discrepancy, people are more likely to engage in harmful behaviors if they think everyone else is doing it right. And so part of what we'll be doing as part of the intervention is giving personalized normative feedback to youth around drinking, as well as dating and sexual violence by student intervention. So essentially we'll be using their data to give them personalized normative feedback, ultimately, hopefully showing that they actually are overestimating, for example, the extent to which they think other LGBTQ plus youth are drinking, and really helping them to understand why there's this disconnect, how it could affect their own behavior, and then linking it back to skills that they've previously learned. So the final session, module 8, this is really an opportunity to review the skills that they've learned, thinking about how they're going to use what they've learned in this program, not only to prevent dating and sexual violence and alcohol use, but really this is meant to be more broadly a positive youth development program. So kind of how are the skills that they're learning, the decisions that they're going to make after the program, help them to fulfill their hopes, goals, and dreams for the future. And then, of course, spending ample time saying goodbyes. There won't be any contact following the program with program facilitators, or, this is really seen as more of like a time limited kind of mentorship piece. And there's precedence in the literature for more of this time limited connection. There's also a lot of ethical and legal complexities if they were to stay in touch with facilitators. However, youth will have the option of staying in touch with one another. So youth who are in the same cohort for a program will have the option of staying in touch with one another for after the program. And of course, there will be, just like all sessions, given lots of resources and making sure that youth feel, confident in moving forward, that they have the supports they need in place if they do have, concerns that come up after the program. So in terms of the evaluation plans, we're going to be doing an open pilot trial in the winter of 2022. So after we get the program fully drafted with the help of our youth advisory board, we'll recruit 10 youth through social media. They'll all go through the program, give feedback, and then we'll use that feedback to finalize the program for the pilot randomized control trial that will be spring and summer of 2022. We'll recruit 200 youth, again, through social media. So they don't use Facebook anymore, they say. So Instagram, TikTok, Twitter, and so forth, YouTube, randomly assign them to treatment or waitlist control. We'll do a baseline, immediate post-test, and a 2-month follow-up. And then again, all the youth in the waitlist control will receive the intervention after the 2-month follow-up. And then we'll do exit interviews with a subset of youth, I believe it's 10 who are in the treatment group. So hopefully, if there's a chance to come back and speak with you all again, I'll have some exciting findings from this project. So just to kind of wrap up, there are very high rates of dating and sexual violence among LGBTQ+ youth. We know that traditional heteronormative programming does not work, that we really have to think about distal and proximal stressors as part of the work that we're doing, not just individual programming to reduce those proximal stressors, but we have to be a lot more intentional and better about really trying to make wider spread community-wide and societal level change to reduce distal stressors. And again, this work, I don't think will be nearly as impactful if we don't have community-led and youth-led approaches to this work. So just in terms of future projects, we have a couple of grants under review right now. So kind of future directions. One is an online mentorship program to prevent adversities among trans and other gender minority youth. Another grant that's a telehealth family-based program to prevent ACEs and dating and sexual violence among sexual and gender minority youth. And then this last one, we actually just found out this morning that we got. It's a formative research project to inform the development of an initiative to prevent violence against Native American, lesbian, gay, bisexual, transgender, queer questioning and two-spirit youth. So this will be happening with a Native or an Indigenous community in South Dakota. And again, it was the best news to wake up to this morning. My contact information is here. If you'd like to reach out, I'm always excited to have new collaborators or to pick each other's brains about ideas that we have. So here's my contact information. And I think now we're going to open it up for questions and discussion.